Radiation poisoning is a mysterious phenomenon that to this day many scientists are puzzled about all of its effects. It has been popularized through many movies and TV shows. But these mediums of media have skewed many facts behind this hidden killer. There are several different types of electromagnetic radiation in the universe that we come into contact with, such as visible light and radio waves. The dangerous kind of radiation is called ionizing radiation, which are ionized particles emitted from radioactive material, such as nuclear reactors and weapons. These are gamma rays, X rays, and neutrons. There are a few ways to come into contact with higher dosages of radiation that have the potential to be harmful. First is through nuclear reactors, and the other through nuclear weapons and radioactive fallout. There are different parts of the body that absorb different radioactive particles, which in turn causes different effects of radiation poisoning. When a cell in the human body is exposed to radiation, its chemical structure on an atomic level is severely altered. The most common part of the cell that is affected is the DNA, which causes issues for when the cell attempts to divide. The affected cell will then either die or attempt to repair itself, which can go one of two ways, which is either it fixes itself or it will misrepair itself and thus become a cancerous cell. When exposed to a medium or high dosage of radiation, large number of cells become affected, which is then compounded when those cells divide, thus creating a domino effect within the body. When the exposed cell attempts to repair itself with damaged DNA, the chance for it to become cancerous increases roughly 400%. The cells that become cancerous then spread cancer to more parts of the bodies, thus following the notion of the domino effect. Eventually, the patient will succumb to the cancer, usually in a much earlier and quicker time frame than the unexposed, many dying within 5 to 10 years after exposure. When the amount of radiation exposure surpasses roughly 70 rads, the cell deaths begin to occur, which cause a multitude of issues. Perhaps the most widely known are the skin burns seen within the victims of Japan and Chernobyl. Cells in the skin exposed to the radiation die quickly and on a massive scale. These areas are extremely painful and lead to permanent scarring. Another commonly affected area is the bone structure. The radiation alters the DNA, causing the cells to divide wrong and causes disfiguration. Also affected is the bone marrow, which produces red blood cells. The affected marrow causes issues where there's little to no blood cells produced, thus leading to hypoxia. The best method to avoid radiation poisoning is to avoid exposure at all. But if that is not possible, then it is best to seek shelter in either a fallout shelter or within a concrete building. If exposure is to unfortunately occur, then immediate treatment must take place. The most widely known treatment is potassium iodide pills. Any other methods of treatment include blood transfusion and dialysis. Any other treatments to combat the symptoms of radiation poisoning is recommended.